advocate, lead by example. Our leads believe. So when you see the employees seeing their leads following sustainable practice on daily, like you can see the hospital director using the staircase, this really encouraging and motivating our teams to practice the same. So this is not building just the healthcare people awareness and commitment to the environment and sustainability domain. It's building the culture in the community. And we will support this, and we will continue to support this, of course. And I believe going with sustainability plans for any healthcare facility or any organization under any business, the most important topic is investing on your people. When they are aware, they commit, there is told to help you to achieve your goals.
Good morning, everyone, and welcome to a new edition of our podcast series. So it gives me great honor and pleasure to introduce Mrs. Doaa Serour on behalf of Mediclinic, as one of our guests to discuss sustainability, to discuss our IAMNOTPLASTIC series. So welcome.
Thank you, Peter. I'm very pleased today to be attending with you this morning and discuss a lot of things related to sustainability and how we maintain this and how we look for the future. This is a great opportunity. Thank you very much for the invite.
Well, my pleasure. We also have to thank you because Mediclinic was one of the first healthcare partners that took on board our product, and not only, but they became an advocate for the product. So on behalf of our business, we thank you for adopting it, and then more so, as we will discover throughout the conversation, we would like to talk a little bit more about the practices that you have at Mediclinic. So we know you have certain goals and so on. So it will be great. It will be great if you can, share with us a little bit of what Mediclinic is doing in terms of sustainability.
This is a great question and a great start. I will discuss first about our goal. Our goal as a company to minimize the environmental impacts from the company to the environment. And we have several sub-goals under this main goal. Being carbon neutral by 2030, reaching to zero waste to landfill by 2030, improving our impact on the climate change, enhancing the use and reuse of water resources, and also implementing ISO standard for environmental management system.
Oh wow! So there's a lot. So, and 2030 is tomorrow.
Is very near. Yes, yeah. We are working very hard. It's ambitious goals and initiatives ongoing everywhere in every hospital and clinics, and we believe that we will be able to reach our goal as well.
But I'm sure you did not start it yesterday. I'm sure this approach has been at the core functionality, at the core principles of Mediclinic for a while now, isn't it?
This is really very good to highlight this because in Mediclinic we didn't say that these goals only is a matter of prevention of pollution to the environment, improvement of health to the environment, but it's very aligned with our strategic objectives and goals to provide the high quality healthcare in a sustainable manner in day-to-day activities.
Well, as a client of Mediclinic, not talking business-wise, as a client of Mediclinic, I always admire the innovation. I always admire I think recently, for the last couple of years, 3 years, I think so, the less paperwork process that is there, the adoption of technology, but then how has been in your organization, how it has been implementing such changes? Because I know sometimes sustainability means also more expensive, means doing things in a different way. So what are some of the challenges that you face?
Peter, this is really very important question. Any healthcare facility or any business starting sustainability journey have some challenges or obstacles, and the most important one is the cost. To initiate projects, initial cost, sometimes it's very high, especially if you speak about energy efficiency projects, spending money on new technologies, enhancing the efficiency of current services you are providing. And I do believe Mediclinic as a group taken step forward in this domain. We have budget for our sustainability topics,
Okay.
and it's part of our revenue with a percent, of course. And we utilize this on annual basis to achieve what we plan on every year and year based on our roadmaps, which is designed specifically and especially for we say carbon neutral. We do have roadmap, zero waste to landfill. We have roadmap, other initiatives as well. We have details, action, implementation
Oh
plans.
wow! So that's great to see that there are processes and timelines and action plans in place to do that. And then hand in hand with this, so how does Mediclinic support the well-being of their employees? So I know that you're looking after our well-being, which are some of your clients, but then for the employees, I know for a fact that. Every time I go there, there is some, or every time you go in the city and you see some activities, regardless, it is the Mediclinic is there supporting. From the top of my head, I think the health checks, the heart campaign. I mean, there's.
Yes, we do have environment, social, and governance strategy. It's covering the three domains: environmental, social, and governance. On the social part, we have a stringent strategy and the plans, not only for our staff, it's also for the community. And we have several conferences, as you said, health checks being done for patients. We participate with regulatory authorities in their campaigns, health campaigns, screening, vaccination programs. And also we do have a lot of initiatives with our partners, whether it's universities like MBRU, Abu Dhabi University, education to the students, and enhancing the researches as well. We go back to your question about employees' wellness and well-being. As I said, we have a stringent strategy for this, including mental health, financial domains, and we have employee assistant program, which is, I can say, 2 years now rolled out in Mediclinic to improve our staff well-being and wellness.
Well, you see, for me, experiencing as a regular client, so I'm talking not about Avani, I'll leave that a little bit on the side to highlight something, to praise. I always admire the empowerment of the colleagues at Mediclinic, understand? So when, because issues are happening, the appointment gets delayed and so on, but I like the ownership part. So whoever is a nurse, is over the counter agent that you interact first, or someone on the phone. So I think the process there is so well established that they always get till the last mile to make sure that satisfaction is there. And I think I have to give you the credit.
Thank you very much, Peter. And I'm telling you, we have really very strong plans for enhancing the client's experience and improving on it. We work on ourselves and we feel good when we receive any comment for improvement. We act immediately upon this. And I believe recently we updated our client experience program, very detailed, including and cover a lot of improvement actions, covering all Mediclinic facilities, hospital and clinics, and you will see a lot of more and more client experience practices.
Yeah, well, that's great. Well, look, we talk about the goal, the sustainability, and your major goal for 2030 to avoid sending anything to landfill. I think this is an amazing goal. So what steps, your businesses or in healthcare can be taken? Because I know lots of times there is the sensitive topic of the hazardous waste and other stuff that you use. So what are some of the steps that your organization has taken to avoid disposing irresponsibly those type of waste?
Sure, our zero waste to landfill starts first with the commitment from the management. This is one of our sub goals. And we worked first to identify what areas we need to improve, starting from good data. Because if you don't have data to compare and to track and monitor later to set your targets, how we need to ensure our data is accurate, starting to assess the weighing scales we have every site and improving and buying new weighing scales, well calibrated, maintaining this, and then about staff awareness and engagement of the staff, why we have to do this, providing the resources on site. If we speak about waste management, we have to provide the resources like waste bins, the segregation, and so on. We have a lot of initiatives to engage our staff, like campaigns and competitions. We created a task force. We call it Waste Management Task Force. Multidisciplinary memberships included, discussing together and brainstorming to get the best idea. And one of the important topic we based on is piloting. We will not say we'll start this project or initiatives across Mediclinic. We start to pilot, prove the concept, and then we roll it out.
Yeah.
And I believe this created, like, we can say, enhancement of the culture change. Competition between facilities that they also would like to implement these initiatives at their sites. And as well as, if I speak about zero waste to landfill, technology playing a very important part, because you want to avoid sending the waste to the landfill, and we know healthcare generating significant amount of hazardous waste and general waste as
Yeah,
well,
yeah.
plus the food waste. So we have detailed plan to work on this with our service providers on catering services. We have a strategy to reduce the food waste and start to look for more innovative way to do food waste composting as well. For medical waste, we are investigating different technologies ongoing now to select one of them to be able to treat the medical waste on site, pressure, temperature, shredding, and then it's becoming a hazardous, non-hazardous waste, and so on. We can avoid having this accumulation to the landfill, stop a lot of single use
Yes.
products, as well as the segregation. I can say segregation on site and as per the source in generated area helps a lot to improve and enhance our recycling figures. I believe 2023 we have increased 12%
Wow.
in recycling, in waste recycled.
Well, look, like in any organization, I'm sure you have lots of disposables. We are happy to collaborate with you on the bags, and then it's a proven thing that we have adopted some of our products. We have different materials from cups to bags to. I know you work with a third party, for example, who is also our partner for your cafeteria and the coffee shops. But is for us has always been the status quo to sit with our clients or the partners and to educate them. So for example, I know for a fact that from your operation team that when replacing the pharmacy plastic bags with our bags, there was substantial reducing consumption versus the plastic bags. So in other words, the team there at the pharmacies, they are more responsible when giving away the bags. So not a bag for every product. So trying to be more sensitive about it, which is what we love. So we don't really want you to sell or to buy as many products of ours as possible. The status quo for us is to don't use single use, like you mentioned, and if you have to use single use something which is more friendly with nature. And that brings me to our second part of the. We mentioned a little bit about your colleagues and what you're doing for the welfare of your colleagues, but. What is the management? What the organization does to inspire and empower the team there to live the sustainable practices in your organization?
I can tell you, we advocate, lead by example. Our leads believe. So when you see the employees seeing their leads following sustainable practice on daily, like you can see the hospital director using the staircase. So this really encouraging and motivating our teams to practice the same. We have extended the education development of our teams not only to our internal programs of training and awareness sessions. We extended this to other educational awareness, and they have variety of sustainability courses to go through it and develop their awareness and the competency and enhance their knowledge as well. I can say competition.
Yeah.
Champion, we have team of green champions. I can say 270 members, green champions across Mediclinic. Yes, it's really,
Wow, that's a big
and
team.
it's growing as well. We have different competitions between the facilities. Like recently, we rolled out the Recycling Champion Award, and just in 10 days, we received 30 projects from around 190 staff. So you can believe that it's really now built in our culture about sustainability and the importance. And I do believe being here in UAE inspires a lot of companies and businesses to do this. This is the second year, consecutive year, His Highness Sheikh Mohammed bin Zayed announcing its year of sustainability
Yeah.
as well. Like last year, and then we have the COP at the end of the year, COP 28, and this year as well. A lot of regulatory bodies start to ban single-use plastic and more coming on the way. So this is not building just the healthcare people awareness to, and commitment to the environment and sustainability domain. It's building the culture in the community, and we will support this, and we will continue to support this, of course.
Well, along the way, it was the same with us. So imagine when we started the business 7 years ago, there were no rules, regulation when it comes to, no options, awareness of, oh, I want to operate a little sustainability, what materials are there, all right? So, and that has been our mission to, I'm constantly on the road to first of all identify organizations that are willing to make the change, and luckily because of the dynamism of Dubai and UAE, we are always at the forefront. So the private sector has driven the agenda in every single aspect. So from hospitality to education to healthcare, airline industry. I mean, we have seen it all over, and I'm glad to hear that you have such best practices for the employees, for the sustainability champions, because I think the merrier the better. The more we have, the better.
Sure.
You know. So, and then we discussed earlier about the well-being of your employees. I mean, I don't know why this comes to my mind, but whenever there is the Dubai Marathon, I see the Mediclinic contingent of colleagues there is huge. There is lots of people participating in that, and yeah, I have to praise you for that, because we believe that the Latin word said mens sana in corpore sana. So you cannot practice something, or you want to give healthcare, if you don't give healthcare for you look like you're healthy and so on. Portray that in front of certain your clients. So yeah, so compliments for that as well.
Thank you very much.
Okay, now, like I think at the beginning when we talk about it, sustainability and so on, you cannot go on without the budgets. But also, when you spend money as any organization, you need to make money, correct? So in from your Mediclinic as organization experience, do you think that by implementing sustainability initiatives has helped your bottom line, your profitability?
Of course, yes. The main challenge is the initial cost. So once you have the budget and you prove the case, you will run. Instead of you walk, you will run. So any healthcare facility, or speaking as well about Mediclinic, invest in sustainability, there will be return back. Whether it's short-term return or long-term return, investing in energy efficiency projects like BVT, solar panels, all of these energy efficiency projects, you will have a lot of profit later. You will save a lot of cost. Converting, for example, the traditional lighting to LED lighting, or other methodology which is energy saving. If we speak about water conservation as well, for example, using some more technology, heat showers, or will save a lot of water consumption, like using low flow efficient flaquets. If we speak about waste segregation, recycling, we start recycling electronic
Waste, yeah.
equipment long time back. There will be revenue and rebate as well. If we speak about investing on our staff, for education and awareness and knowledge and campaigns, this is returning in their behavior as well. And I believe going with sustainability plans for any healthcare facility or any organization under any business, the most important topic is investing on your people. When they are aware, they commit, they is told to help you to achieve your goals.
100%. So wow, that really covered it covered quite a lot of some
Yeah.
other points that I wanted to discuss. So um, because sometimes in the past we've seen that in our partners, some they tried, they tested, and then it became, oh yeah, but it's becoming more expensive. But also we saw that whoever dared to go over a longer period, like sustainability, you talk for the future. You don't want you something that is irreversible. So many, like you said, many of our clients also have implemented such initiatives to look forward, to look at and those then became the competitive starters. Because if I look at some of our hospitality clients, large hotel organizations, for example, the status quo is there. So what are your clients demand in terms of sustainability from Mediclinic?
Uh, the most important thing it's floating now, it's the telehealth. I can say since the COVID time and it was difficult, the patients or client can go to the healthcare facilities premise for any reasons. The telehealth plays a very important role in healthcare uh, ecosystem, and it's enhanced the experience from your comfort at home.
Yeah.
You have access to your doctor, speak, and you have your prescription, your diagnosis. I believe this saves a lot of carbon emission of transportations used to the healthcare facilities. A healthcare electronic health record system, the amount of paper and medical records, tons of paper was printed out on annual basis. Now everything is electronic and maintained,
Yeah.
ensuring the patient privacy and confidentiality of data. I believe the future is bright. Just we have to ensure we sustain and maintain what we are doing. And one of the point I would like to stress on this, if you start this sustainability journey and you are not maintaining it, it will be deviated. So reporting and monitoring, very important 2 points to ensure you go with your goals and achieve your goals.
Well said. So for us, we are like to associate with such organizations like Mediclinic. We also try to evolve our products, but also most importantly to share the best practice that we have. We've seen that certain organizations, for example, implement a certain process where they use less of the materials, or it's very simple. The coffee cup with the lid. Okay, so do you need a lid for the cup?
Yes.
Yes, no. So by doing this, one of our clients, they reduced the consumption by 90%. For us, it's very important that that is applied rather than selling you as many as we can. Do you need a straw? Do you need a cutlery? Do you need a
Yes.
bag? Do you need many bags? So at that level, desert is made of small particles of sand. And look how big is the desert. So to make an analogy, but it's the same with this desert of single-use and unsustainable materials. For us, we are part of that journey to make sure that we use less of them, and then it was great to see when organizations adopted the process how we educate ourselves. So I take again the bag example. Oh, I want, because we saw Dubai, I want a luxury bag, correct? I want the bag to look luxury, to be very thick and presentable. But then what is the purpose of that? Is a pharmacy bag, for example, that takes 50 grams of medicine from the pharmacy eventually to my car, because we don't really walk a lot in Dubai, correct? And from my car, I go to the house, especially when I'm sick, I'm not going to work. So then when we discuss the status, instead to say 80 microns, very thick bags, I say, why do you need that? It's privacy, one, but it's also the practicability. So then we said, why don't we do 40 microns? So it's less resources, it's half of the material, carbon footprint impact. And by doing so, then we even changed the status quo for some of our largest clients. All right, so we're talking the same with the waste, because we're doing now one of the latest product is waste bags or laundry covers. When you do your dry cleaning, some of our clients, they were cutting the rolls at a certain length for all clothes, but Peter is 2 meter tall. Some is 1.5 meter tall. All right, so the cover will go the same. So now we said, why don't we make it on a roll? And then you cut it to the size. So these are just little bits and pieces that we try to instill and convince our partners, our clients to do. So then so then we are more ethically using sustainable materials. All
This
right.
is
So
amazing, Peter. Also Mediclinic is doing the same. We encourage our suppliers and vendors to develop and start their sustainability journey, especially with suppliers. If we speak about suppliers and vendors, packaging.
yeah.
Simple actions can reduce a lot of amount of waste being generated. Supply chain is one of the important topic in sustainability, which can save a lot of emissions, like sourcing local suppliers from the UAE market. I believe this started as well since the COVID time, when we start to see hand sanitizers, companies start to produce this in the local market. Really, in the journey of sustainability, we can't work individually or independently. We have to integrate with partner. I don't see also any competition in this, like healthcare groups working together with regulatory body. And I believe both Department of Health and DHA started this as well last year. Mediclinic as well awarded in the COP, during the COP time, awards for Emerald Muasher KPIs, which is including 15 indicators related to sustainability, infrastructure, operation, and health waste. Two of our hospitals, actually, Mediclinic Noor and Mediclinic Al Ain, were awarded as well. Also, 2023, Mediclinic awarded by IHF Silver Award on the green hospitals. And this really worked and played a very important point for our staff to see whatever you are doing from efforts and initiatives being implemented, it's being awarded.
Oh, recognized,
Yes,
yeah.
it's
Done.
recognized.
Very
Yes.
well, similar to you, we also try to select our, because we also have a supply chain and partners that we work with. For example, we outsource logistics. And then until 3-4 years, just before or after COVID, we had a partner which was great. However, they were not doing much in terms of sustainability. So we looked at it and we said, what is there available on the market? And we find someone who really looks after practice sustainability. So from staff uniforms to using grey water to using some of the biofuels for the trucks. We also, both ways, we look to see, to consolidate deliveries, which was a big thing. So we avoided to reduce deliveries, truck deliveries by 55%. The trips also by consolidated. So that led to two things. First of all, there's the pollution, but also significant cost reduction for both organizations. And we also constantly engage with them and with our clients to see what else we can do to improve, to make things better. We localize production here for the bags particularly,
Yes.
so, and that has done quite a lot of things. So created jobs, we contribute to local economy, but we reduce carbon footprint for the bags by 15%, and the production cycle from 3 months to 4 to 6 weeks, and that has helped quite a lot in terms of dynamism of the business and also our clients, because like we want now, everything is now. So Dubai, correct? We want everything
Yes.
fast. But look, I so like to thank you so much for being present here and then for sharing with us the great initiatives and best practices the Mediclinic does. And then we wish you great success in the
Thank
future.
you very much, Peter. Same here. Thank you for the opportunity discussing part of Mediclinic's achievement. We have a lot, and our plans have never end. And we hope that we, inshallah, achieving our goals in this domain.
Thank you very much.
Thank you very
Thank
much,
you.
Peter. Thank you.